Hi friends, this is Jawad Khan here once again, and in this video I'm going to tell you about a conversation between a doctor and a patient related to COVID-19. The main intention for making this video is to give you an idea that how a conversation between a doctor and a patient takes place related to COVID-19. So let's begin our video without wasting much time. The first question which is asked by the doctor to a patient is, so what can I do for you today? So what can I do for you today? By asking this question, he wants to know about the symptoms of a patient. For example, in my case, I am suffering from COVID-19, so I have the most common symptoms of COVID-19, and these are, for example, tiredness, headache, and high-grade fever. So my answer is like, Doctor, I am suffering from high-grade fever. I feel tired all the time. Moreover, I also have really bad headaches. Okay, now let's take a look of this question and answer from the play. May I come in, doctor?
Yes, please come in. Have a seat.
Okay, doctor.
So, what can I do for you today?
Doctor, I am suffering from high-grade fever. I feel tired all the time. Moreover, I also have really bad headaches. Okay, similarly, we have another question which is asked by the doctor, and that is, when did you start feeling like this? When did you start feeling like this? By asking this question, he wants to know about the time from which you are feeling in the same way. So in my case, I am feeling the same symptoms for 3 days. So my answer is like 3 days ago, or you could say that 4 days ago, or last night, a week ago, or 2 weeks ago, depending on the situation of a person. He or she can choose either of them. Okay.
So, when did you start feeling like this?
3 days ago. Okay, now we have another question which is asked by the doctor, and that is, have you taken any medicine so far, or are you taking any medication? Have you taken any medicine so far, or are you taking any medication? By asking this question, he wants to know about the medicine which you are taking to cure that disease. For example, in my case, I am taking paracetamol. So my answer is like, yes, of course, doctor, paracetamol. Or yes, of course, simply paracetamol. If you are not taking any medicine, then your answer is like, no, not at all, doctor. Okay.
Have you taken any medicine so far?
Yeah, I have taken paracetamol, but the fever hasn't disappeared. Similarly, we have another question which is asked by the doctor, and that is this the first time you have a problem like this? Is this the first time you have a problem like this? By asking this question, he wants to be more specific about COVID-19. Okay, for example, in my case, I am feeling all these type of symptoms for the first time in my life. Then my answer is like, yeah, of course, doctor, I am feeling all these type of symptoms for the first time in my life. Or simply, as far as I know, this is the first time. Okay.
Is this the first time you're feeling like this?
As far as I know, yeah, this is the first time I am feeling like this.
Okay.
Similarly, we have another question which is asked by the doctor to know about the mild symptoms of COVID-19, and that is, do you have dry cough, sore throat, and pains in your body as well? Okay, as these all are the mild symptoms of COVID-19. By asking this question, he wants to be confirmed about the early stage of COVID-19, as I have all these kind of symptoms. So my answer is like, yes, doctor. Yes, doctor. Or if I don't have these kind of symptoms, then my answer is like, no, not at all, doctor.
You have dry cough, sore throat, and pain in the body as well?
Yes, doctor. I have all these type of symptoms in my body.
Oh.
Okay. Similarly, we have another question which is asked by the doctor to know about the serious symptoms of COVID-19, and that is, moreover, do you also have these kind of symptoms like shortness of breath, severe pain in chest, or loss of speech or anything? As these all are the serious symptoms of COVID-19. if you are having these all type of symptoms, it means that you are a serious case of COVID-19. But however, in my case, I don't have these kind of symptoms like this. So my answer is like, no, nothing like that, doctor. No, nothing like that, doctor. Or if someone has these kind of symptoms, these serious symptoms, then his or her answer is like, yes, doctor. Okay, I want to let you know that you have to keep your answer short and up to the point. Okay.
Do you have symptoms like shortness of breath and breathlessness and rashes and skin discoloration in the body as well?
No, I don't have these kind of symptoms.
That's good. Here are some tests I'm writing. Get them done and show me the report tomorrow. Okay?
Okay, doctor. So I will come tomorrow.
Yeah, sure.
Okay.
Tomorrow morning.
May I come in, doctor?
Yes, please.
Here's my test report, doctor.
Just a minute. Let's see.
Okay, doctor.
Your COVID-19 report is positive.
Oh my God, doctor, what are you saying? You know that it's a serious issue.
Relax, calm down, Jawad. Don't panic.
It's COVID-19.
Yes, I know, don't panic. Most people recover from this disease without needing any hospitalization, and you don't show chronic symptoms like aches in the body or rashes or breathlessness. So you need not to worry. I'm writing some medicines for you.
It means that I am in the mild stage of COVID-19.
Yes, you are in the intermediate stage, the starting stage, and if treated, you won't need any complications. You don't have any complications. So here are some medicines.
Okay, doctor.
Take these, and for a while you have to quarantine yourself for 14 days, and in that while eat nutritious food, take plenty of bed rest, and avoid social contacts for 14 days. Okay?
Okay, doctor. Thanks
You'll
a
be
lot.
fine.
Okay, doctor. Thanks a lot.
Take care.
Now it's time to ask some important questions related to COVID-19 from my doctor Syed Momin Iqbal. By the way, I want to let you know that he is pursuing MBBS and he is a second year student of MBBS. Okay, so the first question which I want to ask to my doctor is, so what are the tests which are needed to identify that the patient is suffering from coronavirus disease?
Well, there are mainly two tests. First is the nasal swab test, and the other one is the nasal aspirate test. In that test, then you go to the hospital. The staff there takes a cotton swab and puts it inside your nose and the other inside your throat area, and then it is sent for checking, for testing. It is because the coronavirus acts on the respiratory tract.
Okay.
Yes.
So the next question which I want to ask to my doctor is, so according to you, what are some preventive strategies for COVID-19?
Well, yes, prevention is better than cure. The first one is to maintain your hands, the hand hygiene is to clean your hands at regular intervals with soap, or in case the soap is not available, with an alcohol based hand rub.
Hand sanitizer.
The number second is to wear a mask, and the three is to maintain physical distance of at least 6 feet between the two peoples, and avoid going in crowded places.
Yeah.
And in case you feel tired, or you feel your pulse is feverish, or you have a dry cough, seek medical care immediately.
So the last question which I want to ask to my doctor is, please tell me something about the new strain of COVID-19.
Well, a new strain of the coronavirus has been discovered, and the first case of it was reported in Britain last December. and scientifically speaking, it's B117 strain of the coronavirus, which is 70% more contagious than the former. The earlier one was SARS-CoV strain of the coronavirus. So the importance of it is it spreads at a very fast rate in comparison to the earlier, at 70% faster rate than the earlier.
It has 70% more spreading power than original COVID-19.
Yes, then that makes us more vulnerable, but at the end we don't need to panic.
Okay.
Because the vaccine has been discovered and the trials are running, so we don't need to panic.
Okay, so that's all about 3 important questions which you must know about COVID-19. So that's all about today's video. Hope you liked it, and if you liked it, please subscribe our channel and hit the bell icon so that you will get all the regular notifications of all the videos which I'll upload on YouTube. So thanks for watching and have a great day.
Stay safe, stay at home. Goodbye.
अस्सलामुअलैकुम फ्रेंड्स, मैं आप सभी को ये बताना चाहता हूँ कि मैं कोविड-19 पॉजिटिव नहीं हूँ। ये तो सिर्फ एक प्ले था आप लोगों तक इन्फॉर्मेशन पहुँचाने के लिए कि किस तरह डॉक्टर और पेशेंट में बात होती है रिलेटेड टू कोविड-19, और मेरी रिपोर्ट भी देख ली आप।
अस्सलाम वालेकुम, ये है इनकी रिपोर्ट, देखिए।
बिल्कुल साफ, कुछ भी नहीं।